So once we broke up all those cross bridges and things are starting to, what we want to do is we want to flush out the deeper muscle tissue. So the technique that we use for that is called Petrissage. There's several different types of Petrissage, right? So Petrissage could be, like I said, its primarily function is to flush the deeper capillary beds, whereas Effleurage usually only flushes about the first top 2 centimeters, right? So, so this is going to be involving much deeper. So there's several different forms of Petrissage, and which one we're going to choose is going to be based upon what's the depth of the muscle tissue we're trying to affect. So let's start out with something straightforward. The most superficial one we would use would be a rolling technique. So rolling is kind of like Effleurage, right? It's shorter strokes, and you're applying pressure, and you're kind of having one hand feed in behind the other in a waving type of a motion, right? So it's kind of like a circle, or a half circle, I guess, really. One hand and then the other one half circle. We want to make sure that they're overlying, covering the entire area that we're going to affect. And more so, a technique that we would tend to use for relatively, I'm not going to say thinner, but less, where there's less tissue. Like the back, muscles of the back obviously are very different than the muscles of the gluteal or the muscles of the thigh, say for example, the thickness of them. So rolling is a really good technique. You can use it anywhere, don't get me wrong, you can use it any place, but maybe it's primarily going to target the more superficial muscle tissue. So the next one we can do is called ringing. So ringing is where you're going to, it's a little harder to do on the back, right? So here what you're going to do is you're going to use the heel of your hand on the one hand, and on the other hand we're going to use the pads of our fingers, right? So what we're going to do is we're going to try and pick the muscle tissue up, and that's why I'd say it's harder to do ringing on the back, right? We're going to try and pick the muscle tissue up, and we're going to push it towards our fingers on an angle like that, and then their thumb's going to slide underneath the fingers, and then we're going to come back. And now the other hand's going to pull with its fingers and push toward the palm. Just like that, back and forth. So you can see the tissue bulging up in between as we do that technique. I'll move my hands out just a little farther apart so you can see what I'm talking about. You can see how as my thumb is pushing my fingers, you see the tissue bulging up in between the two, and that's what we're trying to do. So that's called a ringing technique, all right? Affects a little bit more what I would call intermediate level or thickness of tissues, right? Such as that. So that would be ringing, right? And now I'm going to flip down to the back of his legs, because I'm going to show you another technique of Petrissage, and that's called kneading. So a kneading technique, again, we would have his leg exposed. Again, I've got a little bit too much oil, so I'll take a little off. Easiest way to take oil if you get too much on is just use the palm of your hand onto your sheet. There you go, that's good. So again, I'm going to show that ring. So here I can show you better the picking up component. So we're trying to pick up the tissue here, pull it away from the bone, squeeze it between the fingers and the thumb and the heel of the hand. Right? So that's what your ringing looks like. And now we're going to do kneading. So for kneading, what I do is I'll take the sheet, I'll stabilize my knee so that their leg is not going to roll away on me. So what I'm going to do is I'm going to squash the tissue or pull the tissue upwards. So again, we're still lifting away from the bone. So we're lifting up towards the ceiling. And we're going to use the heel of our hands to a nice straight down pressure. Right? And this is called kneading technique. So kneading technique is one that is used a lot when we're dealing with athletes in the recovery phase. So what we're trying to do after an event is we're trying to reestablish oxygen or restore the muscle tissue's energy So kneading technique does that. So again, big thing about kneading, do not slide with the heels of your hand. It's just a straight down steady pressure, compressing the tissues, right? Don't try and slide on the tissues because there is a possibility that you could cause minor trauma to the attachments on the bone. Very minor, very, not a big chance of it, but it is possible. So again, you're going to use kneading on the thicker muscle masses like the calves, hamstrings, gluteals. You can use kneading on a little bit, all right? Yeah.
What about jostling, vibration?
Yeah. So what I'm doing now is I'm just doing a technique called picking up. So you'll see that, I have big hands, so it's easy for me to grab across his calf, even though it's a healthy calf. And I can just simply pick it up and give it a little wiggles and back and forth. And that wiggling depends on where you are. If you're in North America and the United States, they'll tend to call that shaking very often. If you were in Europe, they would call that jostling. And the simple fact of the matter is, jostling and shaking are exactly the same thing, right? Some people try to make it different. Like some people pick it up like this, they'll say, well, that's shaking. And they'll say, well, if you grab the limb at the extremity and you kind of shake it back and forth, now they say that's jostling. But the fact of the matter is, it's all jostling, it's all shaking, right? You're just simply trying to give the tissue a little shiggle back and forth. Now, some therapists will actually even start out their massage doing this before they even actually start actually exposing the skin. They'll just go over the sheet and they'll do a little jostling type of a motion, the back. Again, what are we trying to do? We're trying to shake. And people say, well, is this the right way to do it? And I'll say to them, well, are you shaking them? Yes. Well, then you're doing it right. It's not like you're gonna cause any problem, right? Then we're just shaking them back and forth, putting a little, it's a soothing type of a technique when it's done this way. It helps to establish the first contact with the client and those sorts of things. So it's really beneficial. It's a good tool. And at the end, if we do it at the end, well, it's kind of just a soothing kind of jostling type of a feeling that feels that final relaxation phase, right? Now there's another kind of in this category. They also do a thing called, what they call is vibration. This is also one that is, again, very, very, what I would call proprietary, meaning different schools will describe it in different ways, right? But the fact of the matter is, like, you can, if you place contact onto the muscle like this, and you do a little vibratory type technique like so, it theoretically can cause some degree of relaxation. It's not any different than shaking. It's just that it's more, again, it's more precise. It's more targeted at a specific muscle, whereas jostling or shaking tends to be more of a general type of an application, right? Now, with some practitioners, and even myself, what you'll see is when I'm doing circular motions, like friction, or even if I'm doing rib raking type technique, you'll notice that my hand is shaking, and that's where this would be kind of considered vibratory type of an application. So you can kind of incorporate, as you become more proficient, you can kind of incorporate the shaking or vibratory component into other techniques that you're also doing. But what I wouldn't want you to do is don't try to do everything right away. Let yourself be comfortable with one or two things and then add stuff in. If you're going to combine techniques together, don't try and do it in the first 4 weeks or 5 weeks of your studies. Wait, get to a year from now, maybe 2 years, maybe 5 years. I probably didn't get incorporating the shaking and the friction into the same application and probably till I was in practice for 10 years, right? So it's not something you have to do. There's nobody expecting you to do it a certain way. Remember, massage is an art. So it's how do you do it? And the important thing is, when we ask you, why are you doing that, you can tell us the intent. You might be doing it very different than me. That's okay, as long as your intent is accurate. Okay? So that would be jostling. Okay? They do also, we talk more about another technique called skin rolling, but we talk about it more so in your third quarter of the first year of your studies with the college here, because we use it as an assessment tool primarily. But I am going to show you how to do it here. Now, this is called skin rolling. Now, skin rolling is an assessment tool, and the function of skin rolling primarily, or the result of skin rolling, is normally the skin will kind of lift away from the underlying tissues. However, if there's a nerve impingement or if there's a fascial restriction, the skin will not lift away. The fascia is too tight, so it holds it in place, and we kind of lose that rolling component. So when we're doing rolling, we can start to roll down the back, for example, and we might find, okay, it's pulling away really well, and then you get to a certain level, and all of a sudden it doesn't want to pull away from what feels like pull away from the underlying muscle tissue. That tells us there's probably a dysfunction at that level, right, that needs to be treated with some form of intervention, right? So the big thing about doing rolling, though, is because it is really monitoring the tension in the tissues, what you don't want to do is you don't want to have the client in a position where due to their positioning, they're already creating tension. Like say, for example, when you're doing, you could use him as our client here as an example. If I get him to put his arm kind of down beside him like so, right? Well, here we can see by doing that, there's more tension in your deltoid muscles. So I'm not going to hardly even be able to roll that because it's just because of the position it's in, it's going to be already under tension. So what we would want to do is try and have the client in a position where there's as little tension due to positioning as possible. Right? So then what we can do is, we usually do rolling at a time. I'm just looking to see if we have a towel. What we need to do is we want to be able to grip the skin. So we can't have, that's why some therapists will do this very early on. Like a lot of therapists will maybe do if they want to do the rolling in their massage, what they would do is they would maybe go through and do some jostling to give a general reduction in the tissues, and then they would do some rolling assessment, skin rolling, because there's no oil on the client yet. Because once we start to put oil on the client, there's oil on your hands and there's oil on the client's skin, and it's hard to grip the skin. So, but I'm going to try and see if I can make it work. I'm just going to wipe the oil, since we already were doing some earlier techniques. I'm going to wipe the oil off of his back, right? And then we'll see if we can get it to roll. So what I'm going to do now is I'm going to take my thumb and and kind of pick the skin up off of his back. I don't know if you can see how I'm doing that. And what I'm going to do now is I'm going to roll by moving down. I'm going to roll his skin between my fingers and my thumb. Now, as I do that, I find, well, geez, down here it comes off really nice. You can see how it's bulging up there really nice. If we go back up here, a couple things we're seeing happening. One is, do you see how that's turning really red here? Not so red here where it was loose, but really red here. That tells us there's something going on here. So I'm going to do it again. I'm going to go, okay, yeah. It's pretty hard for me to pick up his skin. Kind of feels like it wants to hold on to his underlying muscle tissue. So that tells me it's got some tension in here, and that could be a fascial problem, or it could be a vertebral misalignment problem that's causing it. So for right now, I would just kind of put a mental note or a note on my file to say, check upper thoracics for vertebral and fascial alignment, right? So that's what you're going to use rolling for. You can do rolling anywhere in the body if you want. As long as you can pick the skin up away from the tissue, you can use it as an assessment tool. That's totally totally fine. He's got a little bit of a shoulder problem here, I think. So I noticed that this one is a lot tighter than this one on this side. When I try to pick the tissue up, I can feel, yeah, this is tighter. A little problem in his deltoid in here, and a little top problem in his infraspinatus muscle, I think, actually, in there. Right? So those would be things we would say, okay, we need to do some assessment of that as we get along. Oh, maybe it's because I had his arms up in that stretched position. Let's bring him down and see what happens now. Well, now it's gone. So that's a really good example of showing you how positioning will affect rolling, right? But now there isn't anything really there. The shoulder doesn't seem to be too bad. He's got a little bit of a problem over here, but nothing too major, right? You're not going to make enough money off of him to book tickets to Hawaii or anything, but you can probably get a little bit more balance in there, right?